the years, MS TeamWorks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
Hi, my name is Lisa Fox. I'm a physician assistant at Johns Hopkins Medical Institute, and I work in the neuroimmunology clinic and focus on multiple sclerosis and neuromyelitis optica. I see patients on a daily basis, and sometimes I will see new patients, but my main focus is to work with the providers, the neurologists that specialize in these disorders, and follow up with the patients. We do have follow-up visits every few months, and we look at MRIs and labs, and we listen to what your symptoms are and how to improve quality of life and activities of daily living. Thank you. This is a great question. I've seen a lot of MS patients have a lot of concerns around the COVID pandemic, and they raise questions to me saying, Lisa, what can I do for myself? How can I help myself so I stay as safe as possible during this pandemic? I've seen increased anxiety. I've seen patients have worsening neurological symptoms that are underlying. And I've had a lot of patients have increased sleep disturbances during this time as well. Patients have, with the anxiety, they wonder, what can I do for myself to keep myself as healthy as possible? And there's no specific medication one can take to say, hey, here's something to boost your immune system, because MS is already a hyper booster of an immune system. It's already attacking our immune system. So we don't want to do that. But we have seen that there's been there's some research showing that self-meditation and deep breathing exercises helps your immune system so that you can reduce that anxiety as much as possible. Controlling the anxiety is imperative, because as more anxious you become, then you might not sleep as well. When you don't sleep as well, the anxiety then kicks in, and it's a vicious cycle. So for our patients to really hone in and say, okay, I can work on my deep breathing, I can reduce my anxieties so that I can have a more fitful sleep, that's very important. I've told a lot of my MS patients not to watch the news after a certain hour so that they can really get a strong night's sleep without their mind going over and over again of the what ifs. The what ifs are out of our control. We think them all the time. It's very easy to do. But as a provider, if I can help eliminate 50% of those what ifs, then they're able to move forward a lot more easily with a lot less stress, and indirectly, then they feel better from an overall standpoint, and their MS symptoms aren't as notable. Another component I've seen how COVID's really impacted our MS patients is the inactivity. A lot of our patients were used to getting up, getting out the door, getting to their job. They walk to the office, they do the stairs. But once COVID hit, we all were at stay-at-home orders, which were appropriate in that respect, but then they were less active. And patients haven't been able to get to the gym, so that muscle memory is not as ingrained in their bodies anymore. And we've seen increased gait imbalance. We've seen increased weakness, tremors worsening, neuropathic pain, like numbness, tingling, burning pain, more prominent just because our bodies aren't working out as much. And it doesn't have to be like running 5 miles. It might be just walking 5 minutes to and from the car, which is exercise in itself, and that muscle memory is not as there. And then increasing the risk of some muscle atrophy and gait imbalance. Also, I'd like to say that I've had a lot of MS patients wonder, what is COVID's impact on my immune system? Will I have worsening outcomes? So I've had a lot of discussions around different MS medications for the patients and how each MS medication has a different mechanism of action or way they're playing a role in our bodies. And some suppress the immune system, some modulate the immune system. And that makes a difference in if somebody does come down with COVID, how their body is able to react. So understanding your MS medication and what it actually does has been a big discussion. And then that understanding eliminates a lot of those what ifs, and then directly reduces some of the anxiety, improves quality of life, sleep, and then it's a nice parallel for patients to get better. Improved exercise then also ensues, and patients tend to feel better about all of that in this world of unknowns with this COVID pandemic. Yeah, the anxieties and the what ifs, as I said earlier, the anxieties of within the COVID pandemic, there's many different levels of anxiety. There's what does MS mean with in COVID? What does my MS medication mean with COVID? What can I do? Where can I go? Can I go out of the house? Those anxieties of that social isolation. What about my mom that lives with me? Or what about my father that lives with me, or my siblings that live with me? What if they have other medical conditions? The anxieties of COVID go beyond just the patient. It goes to their families as well. So if we can understand what their what ifs are, it really helps to make a difference. If it's the what ifs of where are we ever going to return to work? What if my work never comes back? What if I get furloughed for the rest of this time? What if I lose my job? Those anxieties are real, and it's in the public domain, not just for MS patients, for the general public. For a patient with MS who's a significant other might be the one that brings in the money, and they are there on their disability checks. These are all real questions I get on a daily basis. And to understand where their anxieties are and their what ifs are, and then start from the bottom in that respect, meaning starting from what is the first level of that what if, and then building off of that, and then helping them understand the avenues and the social resources that we have through the National MS Society, through your local chapters of the MS societies, through your local institutions in that regard, and helping patients out, getting maybe now, and now that we've been into COVID 6 months, getting home physical therapy or getting into the physical therapy to kind of get the brain moving a little bit more, the body moving a little bit more, to reduce sign of that what ifs what's inside them. So yes, we've incorporated telemedicine into our follow-up patients and our new patients over at Hopkins. We found it very beneficial for majority of our patients. Now there are caveats and there's pros and cons to every new technology that's coming about. But for us, I feel like we've very much advanced telemedicine throughout the nation in terms of seeing patients. We have patients that come from all over Maryland, different states, and the state chapters to allow us to do telemed cross lines from an emergency responding standpoint was brilliant. The states were able to allow us to work with Pennsylvania and Delaware because of the emergency of COVID. So that allowed a lot of patients out of state to still be able to see us, which was very beneficial. Now, the positive of that is that patients didn't have to go out of their homes. They didn't have to go out when a time where there's a lot of uncertainty. They didn't have to cross state lines to see us. And they didn't have to stop at restrooms or rest stops along the road, and they didn't have to do hotel rooms. Now, patients that were local, it was also just the same benefit. That telemedicine's allowed a lot of patients to stay in the comfort of their home when this unknown of what was out there in terms of COVID, and they didn't have to go into the office. I've had a lot of people like, well, can I come see you live? What if there's somebody else in the office? How do I get in? Are you waiting in your car? So having telemedicine to reduce a lot of the what ifs of the COVID along those lines has really been beneficial. I'd like to tell you an example. If telemedicine also allows me to kind of get to know the families a little bit better. I've been able to meet a lot of significant others, a lot of parents and children, because they're home with the patient. Whereas if we had to have the patient come in live, the others might be working or the children might be in school. But I've met so many family members or significant others of families that it's really bolstered the relationship I have with them, so I can understand who is in their lives. And that makes a huge difference in an MS standpoint, because you get to know the patient better. You get to know them from head to toe. So telemedicine's given us that huge advantage in that respect. The example I'd like to share is I was seeing a patient the other day, and this is probably, I say the other day, it was probably maybe April, May timeframe, and she lives alone in an apartment. And she really wanted to see a friend, but she didn't want anybody to come into her apartment. And she didn't understand how close would be socially distant and appropriate for her medical condition. So she was able to take her phone and she was able to show me the outside of our house, where there was a balcony, there's a sliding glass door, and then there's a sidewalk, and then there's a green spot, which was about 15 feet away. And we were able to say, you can sit on your balcony, have your son sit 15 feet away, wear a mask, and you get that social conversation that most of us need, but still stay in a very safe environment with a mask on and socially distant. And that allowed the patient to kind of, you could see her shoulders be like, I can talk to somebody not on a computer. And it really made me happy so I could see what she was exactly talking to in her personal space of her home. So that was lovely. And I also say, as we're moving forward with telemedicine, I'm continuing to hope to engage the routine follow-ups with their telemedicine so I can see their significant others and family members in that respect and continue to treat the patient from head to toe with means themselves as well as their families, because they're an integral part in our MS patients' care. So I've also had patients tell me that they really like to continue telemedicine visits on average, because some of my patients it takes them quite a bit of time to get ready for the visit. It takes them some time to get into the car, and then to drive, depends where they're coming from, and then to get out of the car with a temperature change if it's middle of the winter from their heated car to the outside cold, or vice versa when they're air conditioning and straight into a very humid environment. And then it can exacerbate some of their MS symptoms along those lines. So having patients stay in the comfort of their home without the extreme temperatures, or without having to have that walk to their car if they have limitations in terms of gait instability, it really allows them to have extra energy for the rest of the day so they can do other activities. So that's been a very big plus for a lot of my patients. So after the pandemic, maybe sooner than later, and hoping that we can continue telemedicine and what is going to ensue with telemedicine, I have found telemedicine for my routine follow-ups that I can do a abbreviated physical examination and not have to do a hands-on examination to be highly beneficial. And I hope we can continue that, because it allows the patients extra time at their home, or extra time for their work or their family members and their activities that are important on their daily basis. I've also feel that we've had a lot of referrals to psychology and neuropsychology during this time because of the what ifs of COVID and of their MS. And those are very frequent visits in terms of a therapist or a psychologist, psychiatrist. And to continue that via telemedicine for a lot of my patients would be very beneficial, so that they don't have to, because I have a lot of patients that say, I can't do that because of time. Oh, I have to get my kids this time, and it's twice a week, and I don't have the time for that. I have to drive 30, 40 minutes. But telemedicine may be a huge plus for them to continue that engagement with their therapist to help them cope through whatever may be the anxieties of COVID, their MS symptoms, family situations, etc. So the main thing I'd like for you to take away from this conversation so far is that this is a time of change. We don't know what the next steps are, and that causes a lot of unknowns and uncertainties in everything in life. And what I ask for every one of you, our MS patients, is to know that this is normal, to not know, and to have anxieties and know about the what ifs. So what I would like to have you think about is just to continue to have healthy sleep and have healthy exercise, because that's going to keep your body overall stronger, and it's going to allow you to release some of those anxieties and what ifs so that you can continue to support your MS symptoms as strong as possible.